Hello, I'm Dr. Rajgopal. I'm the interventional cardiologist at Columbia Hospital, Mysore and Kaveri Hospital in Mysore. Let me give a brief introduction about what a healthy heart is. As you know, heart is one of the most vital organs for the body, and being healthy is equal to having a healthy heart. Without a healthy heart, you can't be healthy in any way. How do you define a healthy heart? A healthy heart is a condition in which the person is able to do all his activities without any discomfort and without any problems associated with the cardiovascular system, like having any chest pain, any breathlessness, or any fatigue. Of course, some evaluation of the heart is required to call it healthy, like we do an ECG and an echo. If the ECG and the echo are normal, and if the patient can walk on a treadmill test to the level achievable by a normal person at that age, then it's called a healthy heart. Then let us see, what is a heart attack? A heart attack is a condition where the heart muscle gets damaged. This damage can result usually from blockage in the coronaries or the arteries which are supplying the blood supply to the heart. These coronary arteries can get blocked due to various reasons. The chief among them is a blockage due to cholesterol. These cholesterol blockages occur in the heart, and above them, when a clot occurs, it produces a sudden blockage of the arteries, resulting in death of the muscle. A part of the heart actually permanently dies. This is called a heart attack. And why should someone get a heart attack? Any person on the road or any person we know can have a heart attack, irrespective of the age or the background or whether the patient is rich or poor, men or women. Everyone is prone to a heart attack. The heart attack, actually, the rate of the attack increases as the age advances. Certain factors are there which can increase the rate of the heart attack. It can be classified as a modifiable cause and a non-modifiable cause. A modifiable cause of a heart attack is like the diet, which is bad diet, which is rich in cholesterol and poor in fresh fruits and vegetables. Then the lack of exercise, and bad habits like smoking, excessive alcohol consumption, then stress, which is one of the major factors. Then non-modifiable risk factors like age, sex. As we age more, we have more heart attacks. That's a common sense. And men have more heart attacks than women till the age of 60. Afterwards, both are equal. And the third one is the family history. If somebody else in the family has a heart attack, or if the parents have had a heart attack within the age of 60 years, then the children do have an increased risk of heart attack. So, how do we recognize a heart attack? Heart attacks, the cardinal symptom is chest pain. However, all chest pain is not heart attack, and all heart attacks do not have chest pain. That's a very important thing to remember. Many times, the chest pain occurs due to various other reasons, like the pain due to respiratory infection, or due to the skin and the muscles, or a gastric distension. All these are non-cardiac causes of pain, which is very difficult to distinguish. But the main symptoms of chest pain, which is related to the heart, is that it comes when you exert, when you walk, and when you take rest, it gets relieved. Also, if the chest pain is associated with sweating or unduly exertion, when the patient feels that there is some choking sensation in the chest, or a sense of heaviness of the chest, or the pain radiates to his left side shoulder or the left arm, these are symptoms to indicate that the chance of a heart attack is very high with the chest pain. Apart from chest pain, one can have only breathlessness. They can have only left-handed pain. They can have only giddiness. Some people present with loss of consciousness. All these are rare symptoms, and they are called as anginal equivalents. And these have to be recognized, and especially in a diabetic or an elderly, it may not present exactly with the chest pain. So we know that the symptoms of the heart attack. Then who has the risk of dying from a heart attack? Can a normal person who was apparently walking around die of a heart attack? The answer is definitely yes. We have seen, and all of you would have seen, someone in the relation or in the friend fully normal the day before or the previous moment can have a heart attack and sometimes can have a sudden cardiac death also. This sudden cardiac death due to a heart attack is responsible for around 10% of the deaths within the when the patient has a heart attack, and it accounts for around 25% of the deaths within the first hour. This sort of sudden cardiac death is definitely preventable. The only way we can prevent a sudden cardiac death is to get the medical attention as early as possible. Sudden cardiac death is very common in smokers and also in the elderly. Apparently, people would have gone to bed and not woken up. That's also a sign of sudden cardiac death. By definition, it is a cardiac death is a death which occurs within 24 hours of a heart attack. So, how do we treat a heart attack? A heart attack is treated as early as possible in a cardiac setup. So, the patient, the most vital requirement for the patient to survive is to reach a center with a cardiac facility. It has to be recognized that in a heart attack, time is muscle and time is life. This is not like business where time is money. Here, time is life. So every minute is important when you are treating a heart attack. Whenever the patient has a chest pain, it is important to get an ECG within 30 minutes of onset of the chest pain. If the ECG recognizes a heart attack, then treatment has to begin, and the treatment has to be completed within 1.5 hours of onset of the chest pain or reaching the hospital. So what is the best treatment for the heart attack? There are two modalities of treatment traditionally followed. One is a conservative management where they give blood clot busters, which are called thrombolytic agents. These thrombolytic agents can dissolve the clot and re-establish the flow in the blocked artery. We all know that heart attack is caused due to a blockage of the artery. Most of the times there is a plaque or a cholesterol buildup in the artery, over which a small amount of thrombus or a clot forms. When this clot forms, it causes an acute heart attack. These thrombolytic agents dissolve the clot but not the cholesterol. So the best treatment for a heart attack is to do a primary angioplasty. So what is a primary angioplasty? This is a treatment which is instituted during a heart attack to open up the blood vessels of the heart. So primary angioplasty has to be done in a time-bound fashion. There is something called as a door-to-balloon time. So whenever the patient approaches the cardiac center, he has to be offered a primary angioplasty if there is a heart attack going on. Irrespective of how long the chest pain is, a primary angioplasty is always better. Here we insert a catheter into the artery and we suck the thrombus through the in the occluded artery and put a stent. We do a balloon sometimes, but sometimes we put a stent and clear the artery and re-establish flow. By this, thousands of lives are saved. The main important aspect with respect to an primary angioplasty is the time. The sooner we approach the doctor, the sooner we approach the cardiac facility with an angioplasty, the better is our chance for survival. So, who is at high risk for dying when an angioplasty is there? So, elderly patients in whom some symptoms like breathlessness or giddiness or loss of consciousness occurs, and patients in whom the blood pressure drops very much and there is profuse sweating. These are signs that the heart attack is very severe and the patient is likely to die very soon. Okay, let us now focus on what to do after heart attack or a heart ailment comes. We all know that heart attacks do come when our lifestyle is bad. So the first thing we have to do is to change our lifestyle. The first point in changing the lifestyle is the diet and exercise. Diet plays a very major role, not only in treatment after heart attack, it also plays a big role in prevention of a heart attack. The main factors we have to focus on diet is the quality of food we take. If the patient has a diabetes, additional restriction of calories is required. If the patient is not a diabetic, we can treat the patient with a diet which is rich in fruits and vegetables and fresh organic foods, and low in fats, and also containing a lot of antioxidants like fruits and vegetables. Certain nuts like the almonds and the walnuts and the pista are quite good for the heart. Certain foods like fish, any sea fish is good for the heart. Saturated fats like ghee, butter, dalda, or animal fats like the cheese or the lard, the non-vegetarian sources of fat and protein are highly discouraged. At least we have to eat 5 to 6 cups of fresh fruits and vegetables a day. Avoid eating red meat. Non-vegetarian food like fish and chicken has to be restricted to less than 4 to 5 times a week. And definitely red meat like mutton, beef and pork has to be avoided. Second is exercise. After a heart attack, the first few days we recommend not to move around, to have full rest. After the first week, we recommend the patient to start exercise. Exercise can be as simple as walking. It can also be a little more aggressive in case of young people. We can allow them to do the gymnastics or the swimming, play games, even do a gym workup. But one thing has to be remembered is that lifting weights and isometric exercises which put a stress on the heart, like pushing against a wall or doing abdominal crunch, are not so conducive for the heart, especially if there is a heart weakness of the heart or a left ventricular dysfunction. So we have learnt about this heart attack. Now how do we prevent this heart attack? Prevention is better than cure, we all know, and especially for the heart it's more so true. Some diseases cannot be prevented, like cancer. Many of them are not preventable, but heart attack is definitely preventable and almost fully treatable. Please remember that the future of your heart is in your hands. If you take care of your heart well, you will avoid most of the diseases of the heart. It's a wishful thinking to think that we can actually eradicate heart disease if our lifestyle changes back to our ancestors. Of course, we can't do that straight away. So what are the points we need to note? We can change our lifestyle, reduce the stress, improve our diet and exercise, and treat hypertension and diabetes and high cholesterol as strictly as possible. Of course, healthy people without any of these have to stop smoking, get an annual checkup. If they are over the age of 40 years, an echo and a treadmill test are very compulsory to detect heart disease early in the sitting. Also, we need to stress upon the leading of a stress-free life. Stress is a big killer, and we can definitely live longer with taking less and less stress in our life. Hopefully you enjoyed this talk and learnt a few things. This should stimulate you to learn more about the heart, and wish you a healthy, hearty life. Thank you.